somebody who would voice it to somebody else, then to somebody else, and you'd never really get any feedback on where that information went. So the unique part about this program is that, like I said before, where we work so closely with the top people who are leading the state, we take this information from the networks that we are working alongside. We put it into a data format, and that gets passed straight to the director's office at IDPH. So we work with him very closely. So he sees this, he looks at it with his senior advisor. They decide where that information needs to go, whether it should go straight to the governor's office, whether it needs to go to a work group. And then they report back to us through this feedback loop and say, okay, we've got your concerns. This is who has them. We've told them we need an answer back by this date. So then we can go back to our networks and our people with lived experience and say, we took your concern, this is who it is with, and this is what they're doing with it. And then when something comes, when something changes, when something's funded, when something happens with that, we are continuously receiving information from, as we are continuously sending information to them, they are continuously bringing information back to us on where in their process this, whether it be a barrier, a gap, a complaint, a, lack of resource completely, they are telling us this is how far we are with it. This is what we're thinking about. So we can provide that feedback back to these networks and back to the people in the community and say, your voice is being heard. Your voice is on the desk of the director of IDPH. Your voice is on the desk of JB Pritzker right now. And he is aware of this situation that is happening. And he is actively working with people. They are working together. They are working with their focus groups, their work groups, to try and, make things easier for people to access, make things available for people. Just as much as we want to hear the gaps and the barriers, we also want to hear what's going well, because, sometimes you've got a program and it's amazing, and they don't realize that at the top. So they think, oh, well, we're not having any issues here, so we don't need this program anymore. Well, we're not having issues because the program exists, the program goes away, the issues start up again. So we also want to know what works well. We don't want to be getting rid of anything that works well. We may see that in the Metro East region, we have this something that somebody's doing and it's really helping people, it's working well. That could be implemented in the Rockford region, the Peoria region, the Westchester region. So just gathering all of that information and having this continuous loop of conversations with the people who are in the power to make those decisions, that's really what the feedback loop that we have with the state is about.
That in a nutshell. I know it's a lot of information. So I will gladly send these slides to Kevin if he wants those, but the flyer really does explain it pretty well too. So okay, so with that, this is going to be our second convening we have coming up. So it's going to be virtual. I will have a virtual link sent out. I will send one to Kevin, and then Kevin can disperse it to this group. And if you want to, please join us. We'd love to have you. And this will be an opportunity for everybody to, like Louise said, voice your concerns, voice the gaps and barriers you're seeing in your community, voice all those. We want to hear the raw details of it. So I know I will. So with that, and then I'll send that out to you too, Kevin, with the date. So okay. So if anybody would like to join that convening, I would love to get your email, and then I can add you to our group as well, so you can get all the updates and stuff like that as we have these convenings and leading up to the convenings and so forth. So if you scan your QR code, that's going to I just ask for your name and your email. That's all, and that will then give me a list of people that want to join that. And this is our contact information down here with Tim and Molly are also on. That's who you all met earlier. And then obviously my name is Nadine Louise. And yeah, I think that's about it. I'll send, should I put a QR code for any in the chat? But I mean, send out to everyone. So, okay, I think we're good. I'll stop sharing my screen and then I will answer any questions here. Okay.
Nadine, I didn't realize looking at that, your counties and our Area 5, like our Regional Office of Education, like that you and us match up almost county by county.
Yes, awesome.
Yes, that's very nice. I think
Ryan was like, yeah, you gotta get a hold of this Kevin guy. And I was like, oh,
this Kevin guy, now that you got a hold of him, lucky you, right?
we were talking
Um,
about, we have a service providers meeting here in Bond County. And Emma Bowen, I don't know if you know her.
oh, I love Emma.
Yeah,
Yes.
she said the same thing about you. She just presented to us at our last service providers meeting. I was like, I'm having a meeting with this Kevin guy. And she goes, oh my God, I love Kevin.
Same.
Tell him
Yes, Emma's
hi.
wonderful. I'll have to slip her the $20 I promised her to say nice things about me next time she's here. But no, that's awesome. I'm glad. And Emma's a fabulous. I feel like Emma emails me a couple of times this semester and is like, hey, I just met this person. You got to add them. Or hey, this would be a good, like, she's always out there in the community and doing stuff at the schools.
Esnet has been an amazing wealth of information and just everything for this program. I mean, they are getting us in contact with organizations such as the DEA. Like we got them on connection. I mean, it's a whole broad spectrum of
Awesome.
people. So it's been great.
I love it.
Yeah.
And I was going to say, I know we've got Morgan and Kristen and Amanda. We've got a lot of folks from the community here today that obviously needed to hear this as well, because I think, I mean, again, the more the merrier, really. I mean, the more people we have united in the same thing of it's just the people we're entrusted to serve they need the services. And I feel like at no other time in history, I was a school social worker for 22 years before coming to this job, and I didn't see people get better. I only see people with more needs, really. I mean, and more people with more and more complex needs. So, I mean, and that's a lot of times when I'm presenting, I kind of get this pause from the audience when I say, when I moved to Jerseyville 20 years ago, we had the Elks, we had the Eagles, we had the Moose. All of our church ladies who were then in their 60s are now in their 80s. This is coming to schools and it's coming to health departments because we don't have community agencies that were able to fill the need unless you're, in a city. Most small towns don't have a whole ton of community organizations, and the churches they have are doing the very best they can with what they got. But people don't attend church the way they did, or the folks who were doing those things, who were retired and doing those things, aren't able to keep up with the demand. So again, that's why our partnerships with the health departments and with community agencies are so very, very vital, because otherwise people just aren't getting their needs met. I mean, that's the other that's unfortunately there's no third way, I feel like.
No, you explained that perfectly. I mean, you're exactly right.
That's I'm just stating American reality, unfortunately, and that's what I obviously I know you've got the QR code and you've got the event coming up, which I will absolutely send out. Send me your slides, flyers, whatever you want. Like I said, I'm going to start doing probably a weekly email just because I've got so much coming through. I want people to be able to have, okay, that was this week. Um, but what else do people need to do to get involved? I guess is my big question, and then we'll open it up to everybody.
I mean, really, if any, so our main goal that we're doing right now in the second year of this grant is we are identifying as many networks as we possibly can. So I'm using the word network. It doesn't necessarily have to be called a network. It could be a coalition, a group, just a group of people like you guys who meet together on a regular basis, where organizations, people from the community come together. We're trying to identify as many of those as we possibly can. What we're hoping is going to be the future of this grant is that we are actually working on a Google map right now with our other partners throughout the other regions. And we are putting all of the networks that we're identifying and working alongside into this map. Then hopefully what is going to happen is through the Rural Transformation Project, there's going to be money available, and we're going to be starting to strengthen networks that already exist. So if we have, we may have an area with a network that consists of 100 people, 50 people. And then within that area, maybe the county over, there may be 3 networks that only have 10 people. So the goal is that funding will become available for those networks, groups, coalitions to be able to apply for, to actually grow their network, to try and grow that reach to cover the whole state, so we can all be working together. So, I mean, my big ask from all of you is, if you can identify any of those coalitions, groups, networks for us, reach out to myself, maybe Molly, Tim, so that we can have, similar conversations with those people to get them all on the map as such, so we can start working with everyone to just try and fortify those networks over the next few years, and just try and help as many people access what they need as easily as possible. So that's really where we are now. This is still a pretty young program. It's still growing. So that's where we are right now. Like Nadine said, we don't provide a service. We don't provide an immediate fix to the problem. So we're trying to identify as many people as possible that could become part of this. So as a whole state, we can look at it and say, this is where, obviously Cook County is going to be the darkest color on the map, because there's so many networks already existing there. So as you look at our region, ours is in purple right now. So some are, St. Clair and Madison, they're kind of a little darker purple, and then Sangamon, that's doing okay. But then the others, you start seeing those purples kind of become a little lighter. So that's what they're going to look at and say, this county over here hardly has anything. So let's create a network there. Let's do some funding to get what's thriving in these bigger counties in these rural counties.
Awesome. And coming from, I've lived part of my life in Cook and part of my life in DuPage County, growing up. There is a lot there. And I think the rest of the state is not going to catch up. So having the ability to network and the ability to bring, and if there's a positive COVID takeaway, we've learned to do a lot of things virtually. I mean, I had students when I worked in Gillespie that were receiving counseling virtually and stuff. I mean, it's that is probably going to be how underserved populations get served a little better by using technology and all of that. And again, that's going to be schools, health departments, and libraries that are probably the primary, picking up the primary, just because that's where people are at a lot of the time. So,
and I mean, we've come across places just through doing the work we do. Nadine is much better at remembering these things than I am. This is why I keep her around all the time. But we work with Amari, and they are in a building with 7 other organizations. So they've essentially made their own network. They're in Madison County, and they have, homeless people use their address. So, they're just providing things like that, which is huge. There's things, just little things like that if we could have a network out there where, homeless people can start receiving things, because so many times they need an address to get something going. So just that one little thing opens so many doors.
We were talking about that the other day, about medication being delivered, like little things like that, or, so it's just, there's a whole list.
Yeah.
And human beings don't fit neat little boxes, unfortunately, because one person's set of needs may be similar, but not exactly the. So yes, thus the need for the team and the network, rather than just, it's not a one size fits all deal by any means.
No. Takes a village.
Yes, yes. Ladies and gentlemen, any questions for these ladies? Questions, thoughts, follow up, whether you've got, drop it in the chat or go ahead and ask. Once I get this posted and sent out, I'm sure you'll have a lot more rolling in too.
That's a lot of information to take in right now.
No, it's important stuff by all means. Perfect. Ladies, I appreciate you. Nadine, please by all means get me that stuff and I will get that sent out as soon as possible. So we've got folks, because like I say, as many as we've got in person, we've got many, many more who watch this later on and get a hold of it and see the email as well. So um, with everyone's permission at Bond County, I will add all of you to our mental health first responders listserv, just so you guys are getting our emails and you can that will give you the option to build a lot more connections off of there, because I always feel like, thank you, Morgan. We'll see you next month. Appreciate you. Um, I always feel like, and I love this because once in a while at the end of a meeting or in an email thread or something like that, all of a sudden there'll be a whole bunch more, oh, well, I can do this and, we should meet and we should do this. And I'm like, and that is the beauty of this, ladies and gentlemen. It's a lot of fun.
Yeah.
So very cool. Well, I appreciate you, ladies. Thank you. Um,
Thanks for having us.
oh, absolutely. Thank you for being here. Folks, what I'm going to do next here is I want to, let's see, I'm going to share my screen and I want to discuss some, and I still haven't figured out how to make this full screen quite yet. Let's see what we can do. There we go. I presented this to our, I presented this to our, they're the ALAP coordinators, so they're student advocates through the regional office just a couple weeks ago. It's resources, and I thought this perfectly appropriate, ladies. I apologize. I did not add you to our slide. You added mental health first responders to your slide. I did not add the Bond County Health Department to our slide. So I'm going to give you the hand heart thing that my kids do to each other all the time and say, sorry, I didn't add you, but it's no less love to the Bond County Health Department by no means. But I've got a bunch of stuff I want to throw out. And again, for the folks who are here and then for the folks who are going to be able to see this later, I think this is important. And I'll send these slides out too, just because there's a lot that is out there and there's a lot that some of these agencies offers that no one knows about. DCFS, my wife she was a school psychologist. When our third child was born, we were literally paying to work. So she decided, I'm going to start a state licensed childcare. Molly's giving me an emphatic nod because it is expensive to have children and to work and to pay someone else to watch them. So my wife went through the DCFS childcare licensing process, which I did not know that DCFS, I was a school social worker for 12 years at that time and didn't know that DCFS did that. I knew that they did foster and adoptive care. Obviously, I think everyone knows, and DCFS obviously has a reputation around their child protective services. Maybe not always a positive one, unfortunately. A lot of folks don't know that they also offer intact family services. So if you've got a concern with a kid, this is kind of another one of those, plugging the gaps, right? I would have a student come in who had a problem with fleas or bed bugs or, infestation or something in their home, or had, a roof that was falling apart or something like that, that had an immediate need. And we didn't know. I mean, we as a school district obviously can't do that. So I would make a referral to DCFS. I would tell the family, I am calling. You're not getting your kids taken away. You're not getting any of this. DCFS will send a caseworker and they'll evaluate your situation. DCFS has funds to be able to support you in getting this taken care of, right? People heard DCFS a lot of times and covered their ears. They didn't want to hear it, but I'm like, this is casework. This is not investigative services. So, and like I said, DCFS has funds. They can fund a family, I believe, for up to a year. They're called Norman funds. A lot of people don't know about them. I didn't until probably 6 or so years ago, which I should have, because one of our mental health first responders co-founders she was a former investigator, is currently area administrator for DCFS, Tiffany Gula, and she told me all about this. Oh yeah, we got Norman funds and we can take care of families. They have to submit a budget at the end of the year as to how they'll continue along, but DCFS can meet a lot of needs, pay utility bill. They got a lot of stuff they can do. Didn't know that. Glad to know it, but wanted to throw that out there. I also told my wife when she texts her families and says, my DCFS worker is coming today. I'm like, you might want to say my child care licensing worker is coming today. Because when families hear my DCFS worker is coming today, they're like, okay, Laura, why? Like, not every family knows that it's, you know, that's who you're licensed through. So, we also have Brightpoint, formerly Chassis. They also provide family casework. They and DCFS, I know, have historically kind of had an adversarial kind of relationship, which I don't think is necessarily the thing because there's plenty of needs to go around, in my opinion. It was what fits DCFS better and what fits Brightpoint better is kind of the question. They were formerly known as Children's Home and Aid or Chassis. They provide family casework for students ages 13 to 26, free of charge. Family must be at risk of homelessness. I love Brightpoint because they are very loose with their definition of at risk for homelessness. Like I've never had them kick a kid back to me and be like, no, we can't help them. Sorry. They are also able to offer a lot of things other agencies aren't able to. And again, you have a stigma with DCFS. Unfortunately, it's reality, and a lot of families aren't willing to work with them, so are willing to work with Brightpoint. Nadine, as we had kind of discussed before, I don't care where a family gets the help from as long as they're getting the help. They need something. Let's make it happen for them. So, um, Centerstone in our area are the new SaaS providers. A lot of people didn't know this. We had Locust Street for a long time. Um, the call-in process for them is the same. The CARES line phone number is the same. You call CARES. CARES will tell you they're only for students who are receiving Medicaid. Yes, that is true. However, if you call Centerstone and say, I have a student in crisis, let the family know, they will still come out and evaluate or have parent take them to the emergency room and they can call from emergency room and they can get evaluated there. So Centerstone will come out and evaluate. They don't just offer the services to students who are receiving Medicaid. It's just to go through the CARES process that is that is for students receiving Medicaid. Lincoln Prairie, Morgan was just on here and she's going to talk a lot more about this next month. Another of our co-founders, Chaz Swearingen, he works for them as well, and he'll be here with us next month. But Lincoln Prairie offers inpatient hospitalization for children and adolescents only. They don't have an adult unit. They're also offering monthly professional development, intensive outpatient virtual groups. They offer psychiatric services both on an in and outpatient basis. And when Morgan and I met, she said this, and I think this bears repeating. I know she'll discuss it more next month, but I do want to get this out there this month. For someone who is a current patient at Lincoln Prairie, so if you go and you're on their roster, whether you're hospitalized or not, if you engage in their services, you can get fast tracked to their psychiatric services, which in the area to get in with a psychiatrist or even a psychiatric nurse practitioner, there's typically a multiple week, if not multiple month waiting list. So that was good to know about Lincoln Prairie, how they're offering those services as well. They are also, and this is, if I've been more excited about something in my career, I don't know what it is. Lincoln Prairie is very soon, and Chaz is going to discuss this, offering aftercare resources for students who have been hospitalized, for patients and families to link to services, to continue to follow up with them so a student doesn't continue to be repeat hospitalized. This to me has been the missing link for the 2+ decades I've been doing this. I'm super excited about it. More information coming on that next month, but that is going to be an absolute game changer for a ton of families. Because for me, honestly, as a school social worker for all those years, I had so many students who would come back to school and would have had a rough summer and we would hospitalize sometime in usually early mid-September. And then we would be stable, and then we would get to the holidays, which are a difficult time for a lot of folks, as we all know. And either before or after Christmas break, we would see another uptick in those same students who had been already in August or September, going back in December or January, and then would be struggling again at the end of the year because there wasn't that follow-up. So now that Lincoln Prairie is offering that follow-up piece, yet again, that's another, as we had discussed before, that's another gap that's being filled, which is amazing. Just some of our counseling centers, and these are all links that I will send out when I send these slides out. In our area, we've got Centerstone, Cohen, Restorative Solutions, Locust Street, and then we have our Macoupin County Public Health Department. Folks from Bond County, do you offer counseling through Bond County Public Health? You do. Okay. All right.
We
See,
have a center called Prairie Counseling Center.
say that again. I'm sorry.
It's called Prairie Counseling Center. It's located in the health department though.
Prairie Counseling Center is in the health department. Okay. See, If I would have done a little bit of homework or talked to all of you, I would have. So sorry. We'll get this on the slides. Um, I think I just got a couple in the chat here. Hang on one second, folks. Let me see. What am I missing? Kristen's got to go. Okay, Kristen, thank you. We'll see you next time. And Aaron said, no. Okay, just people who are heading out. Okay, I wanted to make sure I wasn't missing a comment that was going to be pertinent before the end. So, local health departments, I feel like Michael Scott in the office here, other companies that he's going to interview, he just wrote other companies. So, local health departments, Bond County, our new friends, thank you. I know are offering, and again, I want to throw this out to the membership too. I know I'm preaching to the choir here, but I'm going to throw this out to our membership too, because a lot of folks, when I worked in Gillespie, if you looked out my office window, you could see the Macoupin County Public Health Department. It's like right there. However, so many folks don't know what the health departments offer. So again, that's a reason I'm excited about this partnership that we now have with you with Bond County, because if we're linking all of these up, I mean, again, like Field of Dreams, if you build it, they will come. You're going to get a lot of folks through the door who are going to be able to access, oh, wow, I didn't know you offered this, or I didn't know you offered that. So those things are all going to be there. Um, pushing out into the community and then bringing people to you as well, which is amazing. Do you guys offer mobile services? Like, do you guys come into the schools and stuff? Do you offer any of that?
Mobile services as in like immunizations or we,
Yeah, I was gonna say shot clinics or any of that stuff.
vaccine clinics, nursing homes. And we're starting Louise and I are on a vision and hearing grant actually through the state this year. So
Awesome.
we're going to schools for that, so. Yeah. We'll
Awesome.
fly.
It's a good thing. I was walking in to do one of these meetings and I was talking about how schools have become full service, and I walked past Macoupin County has a mobile dental van. And so dental assistants were checking kids' teeth and all of that, and they were parked out front of the elementary school that day. This was last year, and I just said, this is the full service approach that I'm talking about, that, we're, if parents are not able to get their kids there, then we got to come to them one way, shape, or form, which is cool.
We have a great dental program too here at Bond County Health Department. If anybody's
Love it. Awesome. Awesome. Excellent. And then just local resources. I talked about churches, libraries. We've got food pantries, and then individual community agencies and stuff like that. We really have a lot of we have a lot of stuff that I think a lot of people don't know about. And what I've always said to folks is, if one place can't help you, chances are they know somebody who can. So ask the question rather than, just sit there and wonder. And I long said that about schools, and I know that about churches and libraries and health departments and stuff. We're not going to send people away empty with, well, sorry, good luck with that. It's going to be, even if we don't provide that here, I know somebody who can, or call this number or talk to this person or whatever. So it's about the resources, absolutely. And then typically favorite resources, but I think most everybody I've got here, but folks in schools, if you've got a favorite resource, do you want to drop that in the chat for me? Favorite place in your community you refer people to? You guys had mentioned Hoyleton before. They have a good reputation, I know. See if I got anything new in the chat. Somebody got me in here. Let's see here. Needing too many. It's very, very true. And I think it's going to be, like we've been talking about, just a question of getting that out there to people too. Well, folks, we're getting on towards lunchtime, so I think our membership is going to start dropping off here pretty quickly. If anybody's got any questions for me or anything like that, you're more than welcome to throw those out there. If not, we will look forward to seeing everybody in September. I will ask before people go, if you don't mind putting your email in the chat. I want to make sure I've got everybody on here. I'm recording this, so I want to make sure I've got everybody's email if you would. And I'll add everybody to the website. Karen, thank you. Appreciate you being here. Amanda, yes, I've got you. Thank you. You've been with us for a bit. Awesome. Just make sure. Tim, thank you. I'll get you guys from Bond County added. I snapped a picture of you guys' slide while you were presenting too. So we'll get all of you guys added. Fabulous. And thank you all so much. I appreciate you all being here. Thank you again.